Inflammatory bowel disease, IBD in short, is comprised of two major chronic inflammatory disorders, ulcerative colitis and Crohn disease. Ulcerative colitis affects the colon, whereas Crohn disease can involve any component of the gastrointestinal tract from the mouth to the perianal area. These disorders have somewhat different pathologic and clinical characteristics, but with substantial overlap. Their real causes remain poorly understood. But there are well-known risk factors with combination of changes in the microbiome, genetic susceptibility, abnormal immune response, and some set of environmental triggers. Anyone who's unfortunate to have enough of these overlapping will develop the disease. There are over 200 genes, but the genetic influence accounts for only 20 to 25% of the risk of developing inflammatory bowel diseases, perhaps more strongly in Crohn's than ulcerative colitis. Interestingly, having an appendectomy, particularly before the age of 21, will reduce the subsequent risk of developing ulcerative colitis by as much as 60%. Other studies suggest that poor sleep increases the risk of developing Crohn's, not ulcerative colitis. With respect to diet, intake of low simple carbohydrates increases the risk of Crohn's, but has no impact on ulcerative colitis. Low exercise increases the risk in Crohn's, not ulcerative colitis. Depression prior to the onset of disease leads to an increased risk of Crohn's, again not ulcerative colitis. Smoking surprisingly has this divergence between the two diseases, where the effect is that it reduces the risk of ulcerative colitis. People who are smokers who have ulcerative colitis have a milder course than non-smokers. Once you have quit smoking, your risk of developing ulcerative colitis goes up higher than if you had never smoked at all. There are lots of people who decide to clean up their act, they quit smoking, they're going to get healthy, and then some months to years later they develop ulcerative colitis. The other side. Crohn's disease risk increases with smoking. Non-steroidal anti-inflammatory drugs can increase flares and increase hospitalization. In addition, increased intake of meat consumption, particularly red meat and processed meat, as well as alcohol intake, all increases the risk of ulcerative colitis.